Okay, terrific. All right, well, welcome everybody. It's so nice to spend Tuesday night with you. This is actually one of my favorite new speeches. If you don't know me, I'm Valerie Sayer. I'm a registered and licensed dietitian nutritionist and international marketing director, medical exercise specialist, and owner of Nutrition Connection Balance. I've also been a Reiki master since, oh my gosh, now I'm thinking 2020. 2003. Wow, 20 years already. Time flies, doesn't it? I was a previous director of a compounding pharmacy. I'm a mom of 4 boys and a girl, and I've completed 3 full marathons, many smaller races, and 2 natural bodybuilding shows. So I still love activity, and all our kids play different sport. But tonight is about you and how you can add more onto your learning, as well as looking at how you can really make sure you're on top of your game for prevention. So we had a quiz. If you didn't get the quiz ahead of time, just make sure you talk to the person that invited you. If that person doesn't have that, you can email our office, ncbteam@nutritionconnectionbalance.com. They'll make sure you have the quizzes. And you can write down the answers as you go, and I'll make sure at the end, if you don't have the answers, we'll go there. So the reason we start this way is to get your attention, because people always tell me they're healthy, and yet they might be on 7 medications, and then they start talking about what medical conditions and surgeries they've had. So we have a little bit of a skewed message about what healthy actually is. And we know that 87% of Americans have at least one chronic disease. That means not a bump in the road, but something that's continuous. The United States is 5% of the world population, and we consume 75% of the world's prescription drugs. So it tells us we're not doing something right. Aspirin in the US is said to decrease heart disease. In fact, we just had this topic with my husband who had a partial knee replacement, and I said no, because aspirin in England studies showed no effect or benefit for heart disease. Last year, the American Heart Association, 2 other organizations, said you should not take aspirin because of the side effects are bigger than the benefits. And yet people still believe and are told all the time to take aspirin. They find there's a placebo effect. The first heart attack actually happens at approximately 65.6 years old, and the approximate age for first-time cancer is 66. And obviously we know that's all different ages for different things. But we're starting that way so you can really think about yourself first, then think about family, friends, and people that you love as you go on and learn about things that you can do to make sure you're at really the highest level that you can be. We know that some other facts, that worldwide depression will be the #1 cause of disability. COVID has changed people, where we show about 35 to 45% of cases have cognitive changes, such as brain fog, neurological changes, tremors, confusion, apathy, extreme and chronic fatigue, exercise intolerance. I know a friend of mine had exercise intolerance for almost 6 months afterwards, even though she's an avid exerciser. Mental disorders doubled in the last 10 years in children. Isn't that amazing? And that's just between ages of 12 and 17. And in 2021, 40 million Americans, approximately 18%, all ages, experienced some level of high level of actually diagnosable anxiety. That doesn't mean just general anxiety. So they're saying by 2050, which I believe it'll be before that, the number of people age 65 and older with Alzheimer's and dementia is projected to be 12.7 million. And I know people that are taking care of both parents with Alzheimer's, dementia, and they're not even in their 80s or 90s. So it's really, we really are looking at, there's a lot of different things, not just COVID and viruses and cancer and heart disease, but all sorts of things that affect our well-being. So the first question was, how many Americans have at least one or more chronic diseases? If you have your quiz, it's 87%. And the second was, COVID can contribute to what type of cognitive changes? Brain fog, neurological changes, fatigue, and exercise intolerance. All right, see how smart you are already? All right, look at that. You already got 2 questions down. That's pretty good. All right, don't worry, it'll get more fun. So you'll learn what to do about these things, right? We don't want to be doom and gloom. We just want to make sure we know what the facts are, because you're not alone, if you're struggling with some of these. So we know that one of the things that we want to do is absolutely, we want to measure inflammation. And the reason I start here is because we know that inflammation contributes to all of the things we just talked about. So how you measure inflammation is by a highly sensitive C-reactive protein test. So HS stands for highly sensitive, C as in cat, R reactive, P as in protein. And an ideal level is less than 0.8. Mild is 0.8 to 1, medium risk is 2 to 3, high is 3.1 or greater, and 10 plus means there is a condition already present or around the corner that's very serious. And you can see here is somebody that I had tested 4 months ago. It was a 1.5, then we got them down to 0.8. And so luckily they didn't have any chronic diseases yet, but again, that often can precede that. So systemic inflammation is the fire. You know, that's like when you put igniter fluid on a fire. That makes it blow, everything else blow up. So things that you might have genetics for, or even a propensity for, or maybe you're having a hard time with a bump in the road, these can inflame those and cause other things to turn on. So systemic inflammation is very important. You can ask your doctor to do this. Often when I ask doctors to do this, they test the wrong thing. And the reason they tell me they don't test the highly sensitive CRP is they don't know what to do about it. Anti-inflammatory drugs and steroids only increase the risks of those same conditions. So you have to do it another way, which you're going to learn as we go through. So you want to make sure it's the highly sensitive CRP. When you do regular CRP, that's really for an injury, for a wound, you know, a surgery, that kind of thing. That's different. Okay, that's where you have chronic pain in one area. Okay, so very, very important. So why is it important? Because again, when we look at this, inflammation is what turns on everything, including the proliferation. Boy, you can tell it's a Tuesday night. Proliferation. Let me say that slowly. All right, so we're going to have a sense of humor tonight, I hope. So it means that it can make the cells, see the round cells there at the top, and then look at the wonky ones. Those can, inflammation, systemic in anybody, can actually change and turn on cancer cells, especially tumor cells. And tumors can start very small, and you can actually change them with environment and lifestyle before they get to a cancerous size or level. And how we know that alters inflammation, besides poor eating, poor environment, not enough sleep, different toxins, is all sorts of other things like our digestive system, as well as DNA damage, and then all these different floodgates open up and change our cell structure, and as well as increasing different things that alter the cell, that turn them into tumors and cancer. So one of the things that we know is that carcinogens are one of those things. And we went through all different level 1 carcinogens in the CEs that I did this weekend. And boy, I'll just share a few of them with you today. But again, they're ones that people all want to defend, like red meat, like hot dogs, like alcohol, and they are level 1. That means we know they contribute to cancer or cause it, period. So it just, again, once you have more and more knowledge, it doesn't mean you can't ever do something fun if it's your favorite food or favorite thing, but really start looking at what lifestyle things you can change. So we know the brain, and we're going to tie all these in, I promise. We're looking at different things because I want to make sure that when you're learning, that you can really find a way to understand where this affects all of us, whether you have an infant, a grandchild, a friend, a neighbor, a spouse, a partner. All of us are affected by all these things. So we know that the brain is 60% fat. That's number 3. The brain is how much fat? 60%. Isn't that amazing? I know Dr. Sears calls people fatheads, which is pretty funny, right? So we have to, again, amuse ourselves with this, because, you know, when you think of your head, you're like, man, that's pretty hard. How can we have that much fat in there? But 60% fat. So you want to eat more healthy fats: wild salmon, avocados, nuts and seeds, extra virgin olive oil. 4 slides we talked about in the cancer prevention on extra virgin olive oil. And you're going to see why again pretty soon. So again, very, very important to have the right fats. If you have allergies or, again, certain conditions, of course, don't eat those foods. But in general, even when I've done genetic tests on lots of people, none of those foods, food sensitivity or other things are different, but none of those foods have ever come up as genetically negative. They've always been normal, or there's an enhanced effect genetically for those particular fats. So we know they're good unless you have a sensitivity to them or an allergy. You want to avoid trans fatty acids. Trans fatty acids are fake. Your body doesn't recognize them. It doesn't know what to do with them. They block and change the molecular structure of things in your cells, as well as your endothelial wall, that affect heart disease, blood flow, and good health. They're only in processed foods. They're only fake, and they're hydrogenated or fractionated palm oil. So you can look on labels. Don't just look for 0 trans fat. We have a glitch in the law. You can have half a gram. So you've got to look in the ingredients and make sure it doesn't have hydrogenated or fractionated palm oil. You want to also limit your saturated fats, red meat, butter, cheese, pastries, coconut, whole eggs, and you must supplement. And the reason I say that is essential fatty acids are essential. That means our body does not make them. You have to get them. And with testing thousands and thousands of patients, every single adult, infant, child need to take essential fatty acids, period. We'll get down to how much or what kind, and that's a different study. But you can even look here and look at the brain, how different it looks when there's a healthy brain and one with anxiety disorder. So again, it does affect the brain in MRI, but guess what? You can change this with anxiety disorder and make it look like the normal brain, even if you have severe anxiety, by exercise. It won't work long term, but it's pretty amazing. I remember at one of the facilities that had tennis courts where my son played tennis, they always had the pictures of the brain with exercise. And then, of course, if you took lessons or more specific things, different movements, as well as classical music, actually make the brain light up even better than the normal brain. So exercise helps dramatically. And you're going to see where there's new studies that's showing even with severe cancers, it's one of the most important things you can do to reduce your mortality, risk of getting cancer again, even if you're tired. It's very interesting how important exercise is. And we know for depression and anxiety, it's very, very important also. So it's something that you definitely want to be doing regularly. We know that when we're looking at the brain, this is what's exciting. You're going to see how these start to tie in with that fatty brain, the cognitive functioning, depression, anxiety. But we know, this is a 2022 study, that they showed that when you have good levels of omega-3s of DHA, which are mainly in the juice plus omegas and seafood, your risk associated with Alzheimer's and dementia is inversely related. That means your risk, the better your DHA is, the lower your risk of all incidences, no matter what the reason, of Alzheimer's and dementia. Isn't that incredible? And Framingham studies are huge studies, thousands and thousands and thousands of people. So tells us again why we want to make sure we know what your essential fatty acids are. The omega index is the gold standard. The thing is that what a lot of companies and people promote is just the omega index. It is not enough. You have to look at the whole report. There's 7 pages, but there's 4 pages that have every essential fatty acid in your body, every single one. So you can't just look at the index because you've got to make sure you have the right balance and everybody's different. So this is an example of someone that came in with a red zone of a 3.44. No matter what, any age, you want 8% and above. And if you want the highest prevention, you want 10 to 12. And that's prevention for Alzheimer's, Parkinson's, disease, cancer, COVID post-symptoms, inflammatory conditions, joint health, cancers. I can go on and on and on. Just to give you one example, using this particular erythrocyte, which is a finger stick test, it is actually the #1 way to reduce your risk of death from all causes, just by having your omega index in the green. Again, we have these answers. Why don't we teach this? I went to my annual visit today. I go once a year to the doctor. It's very difficult for me. The doctor's very nice, but it's just so basic, but I go in case I ever have emergency or I need something. I better have a physician that has seen me once a year, and that's all I got. And she asks me the same thing every year. Wow, you're not on any medications. Wow, you're fitter than last year. Wow, your blood pressure is lower than last year. Every year since I've lived here. It's fascinating how they're just shocked. They look at their papers again like, that can't be right. So you can get better with age if you just keep adding on the skills and the tests that you need to do that. Okay, so inflammation is controlled, #1 is by essential fatty acids. And that's clear by study after study after study. Okay, so what's a way to increase your omega index? Through certain foods. Guess what? We're going to repeat them over and over until you have them memorized so you can teach this. Seafood, again, if you can eat it. And it needs to be wild salmon, nuts and seeds, extra virgin olive oil. It should say extra virgin in front of that. That's part of what we talked about in the cancer studies. avocados, and of course, guacamole. And you can make guacamole, that's a much better way. But if you buy it, just make sure you read the ingredients. Okay. You don't want hydrogenated oils. You don't want a bunch of other crap in there. Okay. And then proven supplementation. The Juice Plus Omegas are vegan. If people have seafood allergies, they're plant-based. There's extra ingredients for skin and eye health, but they especially, in every case I've ever had, increase the DHA. Does not increase the EPA, I'm going to tell you. But it does increase the DHA. So I almost always use a combination. However, if you're not going to test, no matter what, take at least 2 of the Juice Plus Omegas. And if you're over 50, no matter what, take 4. And it's not going to be exactly the right balance, but it's never going to hurt you. Okay. And you won't be in the deficiency range. Okay. There's also fish-based gels. However, you want to work with someone like myself that's worked with thousands of patients. You don't just take one. There's 7 other ones I have in my office, and I only use them when I do the test. That's the full 4-page test. So I know if someone needs something more than the Juice Plus Omega, or if they need a certain balance of something. You want to make sure it has the NSF standard. That way it has the least amount. Notice I said least. Anyone that tells you there's 0 toxins in any essential fatty acids are lying. Okay. And when they tell you, well, they're cold pressed and all this stuff, they all are. Can you squeeze a fish and get oil out of it? It's amazing the misinformation to get people to listen that are not actual science facts. My degree is food and nutrition science. So there is a science to all of it. So we use a lot in advertising, and with a lot of companies, they use a lot of things that prey to your common sense, but that doesn't mean it's scientifically sound. So you want to see a clinician that's had thousands of patients. If you do take a fish oil other than the Juice Plus Omega, and make sure it's individualized to your body and your levels. Okay. But the good thing is at least if you're not going to test, at least I know you can take the Juice Plus Omegas. It will not hurt you. I've never seen anyone imbalance any of their Omegas, and it always makes the DHA better. So that's really great. And the index, it just may not bring them up to normal. Okay. But again, almost every person I test is in the red to begin with. So for goodness sake, we've got to help people. And when you have babies or children, you can open the gel, put it in their food. You can put it on skin. You can put it in smoothies. Super easy to do. Okay. So what are the characteristics of metabolic syndrome? The reason we're going to this one next is, and let me just go back to number 5 on your quiz. The essential fatty acid that may reduce Alzheimer's and dementia is DHA. That's an omega-3, DHA. What's the optimal omega index? Number 6, to lower your risk of heart disease, systemic inflammation, and all mortality. That means death from any cause. Is the index should be 10 to 12. Okay, so now we're on number 7. So what are the characteristics of metabolic syndrome? You're going to see this is one of the things that Americans are really starting to have in children. And it means that they're having a lower good cholesterol. We always think HDL, we're happy when it's higher. All your other lipids like LDL, triglycerides, cholesterol, we want them lower. But HDL is the good one produced by the liver. We're happy when it's higher. And guess what? It's influenced the best by the right oils. What are the ones we just talked about? Extra virgin olive oil, the right omegas, wild salmon, avocados, nuts and seeds. See how it comes back to even other conditions? That's the main thing besides exercise that increases HDL. Visceral obesity. So that doesn't mean you just have a big belly. You could be skinny fat. That means you don't exercise, you eat like crap, but you have a good metabolism, so you look thin. That's where your body fat around your organs are a larger amount. So if you do your body fat, that's the only way you'd know that. Insulin resistance. That means your pancreas is making enough insulin to take up carbohydrates, but it sits out in the blood or dumps it. And that causes all sorts of damage, heart disease, vein and visceral issues, edema, as well as weight problems and body fat. Hypertension, that's higher blood pressure. We just had a wonderful 3-way call with one of my colleagues, Marilyn, with a really lovely lady. And, she was really exercised every day and all this, and they just keep putting her on, which is typical. The first, the second, a third blood pressure medication, or a first or second and a diuretic. And the reason is that almost every American, by the time they're 50 and up, is put on a blood pressure medication. When they looked at a study called the DASH diet, look it up yourself. I don't even counsel my patients on it anymore. DASH, Dietary Approaches to Stop Hypertension. Look it up by the National Institute of Health. You can get a 40 or 62? I think 62-page free book that explains every little thing. They've done 2 studies showing that anybody, even genetic forms, can lower hypertension through diet and exercise. They've actually stopped a second study. First one was over 30,000 participants, showing that when you eat the right foods and exercise, you can lower blood pressure better than double or triple medication. Now, I'm not saying don't take medication if you have blood pressure. I'm saying look at starting to transition that. And then high triglycerides are the fat that floats around in the blood from carbohydrates. People always think it's just fat, but if you have too many carbohydrates that are unhealthy, bread, cereal, rice, pasta, desserts, wine, that increases your triglycerides, especially with age. Okay, so metabolic syndrome is something that causes risk in from all these different markers that affect your well-being, your risk of heart disease, and you feel like crap too. So we want you to feel well. Okay. So what's one of the best ways to lower your risk of developing insulin resistance? Remember, a quarter to all third Americans have it. Half of all children are obese that have it. 20% increase risk of developing insulin resistance at any age if you skip breakfast. And what do most people do? Skip breakfast, hardly eat lunch, hardly eat snacks, and then eat from dinner until they go to bed, right? Ice cream, pizza, so on. The thing is we're supposed to eat the most in the morning after fasting. And you've got to have a carb and a protein. And that's one of the best ways to lower all those things that I just went over with metabolic syndrome, is to have breakfast. We just had this conversation with a really lovely lady, and she's saying, what do you eat for breakfast? I said, since I was 15, it's 2 breakfasts and sometimes 3. That's it. It's a smoothie. We'll talk about that. Egg whites and avocado and half a cup of fruit, or I make a protein pancake with my powder, a quarter to a third cup of oats, egg whites, and fresh blueberries. It depends. If I do my long workout, certain mornings it's 2 hours, then a shake, I have to have a shake and my protein pancake. I have to have a little bit more. So that's what I have 99% of my breakfasts for the last 40 years. Not joking. So again, there's clues to what help keep people healthy. Okay. All right. So when we look at that, we just said number 7, what is one easy way to lower your risk of developing insulin resistance? Eat the right breakfast with the right carb and protein. Okay. So we know there's links to cancer, and one of the biggest ones are pesticides and herbicides. We know the mechanism. We know that it causes DNA damage. It disrupts hormones. There's oxidative stress, which can be from not enough fruits and vegetables, inflammation. We've talked about that, whether it's from the immune system, whether it's from crappy diet, whether it's low essential fatty acids. There's procarcinogen activation, which again changes that cell structure. Remember that inflammation where the cell looked nice and round and pretty and yellow, and then it got bumpy? That again is what can activate cancers. So pesticides are a very large one. And again, so you see the cancer cells up top here where they start to change. We want to get them when they just start to change and get them to change back before they get larger and proliferate, which means they just keep replicating, sort of like when you're pregnant and the baby just keeps growing, right? Or grow in tumors. So one of the reasons that we talk about this is the herbicide glyphosate is one of the worst. It's one of the ones that I test for. It's a simple, really simple, inexpensive urine test, but there's a 41% increase in the risk of just lymphoma just by having high glyphosate. And the issue is that we know all herbicides and pesticides contribute to cancer. And the thing is that some people have different genetic tendencies towards this because of how they detoxify or can't detoxify. So there's a 12-point genetic test I can do that looks at breast cancer in particular for male or females, and it tells how you detoxify certain genetic codes. And then it tells us what lifestyle things specific to you you'd really want to make sure you extra focus on. But one of the most important things is to keep glyphosate out of your urine. One of the things that I had put on when I was explaining about this lecture was that they showed that in Americans in 2022, and this got brought up in the cancer lecture, 90% of Americans have glyphosate in their urine, 90%. And it's mainly from produce, processed grains, so all the crappy cereals and Doritos and crackers and chips and all that stuff. Cheerios is one of the worst, has the highest glyphosate. Wines have it, lawns, golf courses. So we've got to be really cognizant of how we grow our food, when we're buying organic, how we're washing our food, all of it. And so what was important though, and I think when we talk about this, this doesn't mean that you should not eat fruit and vegetables and you should eat garbage, McDonald's, because that is going to have even more glyphosate because of the bun and all the processed food. So remember, grains, when you think about it, people are like, well, I don't understand. Well, just think about any grains that are out in the field, right? They get sprayed. And when they get processed, they get concentrated. So that's why we say whole foods are the best, organic foods are the best, at least the dirty dozen and the clean 15, and then also making sure you grow your own foods. Okay, so we know that there's a 41% chance, that's number 8, high levels of glyphosate, the herbicide tested easily by a morning urine sample increases non-Hodgkin's lymphoma by 41%. And we can go on and on with all the cancers, but I like to just show one that just kind of rings a bell, okay? So what are things that we can do to protect ourselves? Remember, we talked about the avocados. Again, we're going to keep coming back, how these all come back to certain things that are the foundation. Well, the best tree fruit, what tree fruit has 19 milligrams of glutathione as a healthy fat? Avocado. There's 10 to 13 grams of fiber in a medium whole avocado. A serving is a half. There's 345 grams of, I should say milligrams, I realize that, of potassium, 19 grams of glutathione. Glutathione is one of the most helpful ingredients that actually is an antioxidant against COVID, oxidative stress, cancer, as well as glyphosate. So very important. Really good if you don't like avocados. I didn't like them until I got older. Now I love them. Is you can put them in your complete smoothie. That really is a nice smooth mouthfeel, and children love it. And you can also put it on egg whites. Avocados is delicious on egg whites instead of cheese. I mean, when you slice it thin, it's just delicious. You can't even tell. So it's amazing once you start switching over how easier it gets. And again, if you're really, busy with time, I remember when I was working many, many hours and weekends with young kids, I bought guacamole. Or when I was at Marilyn's house, she had the most guacamoles I've ever seen, avocado guacamoles, the most avocado I've ever seen on the windowsill. So she just gets so many. She always makes sure she has them and they're ripe. So sometimes avocados are a little hard to get ripe, but you can buy guacamole too. So that's another option, just to put a dollop on that. And they're really good on potatoes, things like that too. So it gives you some ideas besides the smoothies, but really helpful, good essential fatty acid, great fiber that detoxifies, has natural glutathione. So does asparagus. Asparagus has, for a half cup, about the same amount of glutathione, by the way. So again, those vegetables are really good for us for so many different reasons. So when we look, we want to make sure that we avoid having larger body fat around the organs, even if you're thin, or a bigger belly. So a lot of times when people don't want to measure their body fat or can't, or are embarrassed to, I just say measure your waist. Women want to have, unless you're very short or very tall, around 35 inches or less, and men want to be 40 inches or less. Of course, that is not going to fit if you've got a 6'6" man or a 4'10" woman. And then people get all crazy about where is the waist. What I say is, waist typically is where the thinnest part is. But if you're really just looking at improvements, let's say your waist is 40 and you're a woman and you're just not happy about that, just always measure it at the belly button, because waist changes. So sometimes people are like, well, I don't know where to measure. So sometimes I say, don't then worry so much about the number, just make sure it's going down, because waist fat is one of the biggest indicative things of also mortality and heart disease from all causes. And so that's where you can just take a tape measure and measure it around your belly button, okay? So fiber is so important. We're going to talk about number 10, how many minimal grams of fiber per day can lower toxins and possible intestinal conditions such as colon cancer. And it's 25 to 35 grams a day. This was clear in all the new studies on cancer. Over and over and over, she talked about this. And we know why. High fiber diet is associated with lower risk of several cancers, colorectal and breast cancer. Higher consumption, lower blood glucose, insulin, and IGF levels, which is insulin growth hormone. Fiber is associated with being more full and weight control. They actually changed the gut of our gut microbiota or microbiome. They decrease inflammation, and they increase fecal excretion of carcinogens that we get exposed to. So 90% of Americans have high, or they didn't say high, but glyphosate in their urine. For goodness sake, what's one of the reasons? Because we don't get rid of it. So fiber is a must. And you can see the foods that are highest in fiber are plant foods. Okay, so very important. So one of the things that we were just talking about this with the patient that I recently had that had cancer and is doing very well, is that how do you get it in every day? Why I am successful with fiber is I get more than half that I need every morning. If you don't start the morning with high fiber, it's almost impossible. Someone said, no, I have a salad at lunch. Well, unless you have 14 vegetables in there, that's still only 4 or 5 grams of fiber. So I start mine with the complete shake, that's 7 grams of fiber. I add a scoop of Perform because I need more protein. You could do two scoops of complete and have 14. You can put a half of avocado, have 5 in there, right there up to 12. You could put greens from your tower garden, that's 1 to 2. You could have half a cup of organic berries, that's 1 to 2. So I start my morning, and then when I have my protein pancake on my heavy workout days with my shake, I have already 15 to 16 grams. If you don't start out having 10 to 15 grams for breakfast, you almost never make it. I'm just going to tell you. And so you really have got to work hard to get the grams of fiber that you need. And 25 to 35 is the magic number. When they showed in all the cancer studies, they said the real magic number was 30. So again, I like to say 25 to 35 because they look at all data and different things, not just cancer, even toxins, that's the range. So, and if you're eating 3 or 4 grams a day, for goodness sake, be careful. Work your way up to it after a few weeks. Maybe start with just a complete smoothie with water, then work within 2 weeks, work up so you're getting 10 to 15 grams of fiber at one time. Because sometimes you can get some bloating or some gas. It does pass. Okay, so fiber is very, very important. The reason I recommend the complete shake, and I still do for 21 years, is there's 2 medical studies. Number one, it's the highest fiber shake out there. It's plant-based, it's vegan, it's gluten and dairy-free. They do test for contaminants, glyphosate, and all of those things. It has a low glycemic index. People tell me all the time, oh, it's high in carbs. No, it is not. 20 grams minus the 7 is 13 grams. I always tell people, well, what do you think is high? Because what are they eating? And then when they tell me what they're eating, it's ridiculous. They're eating 50 grams at a meal of carbs. I'm like, okay, so when we look at this, the reason I say it's low carb is because when I work with type 1 diabetics, they have meters. They have, different types of pumps that are attached to their phones and their computers. And we can see that when they're on complete for a year or two, their insulin needs are less. So we know it does not spike insulin or glucose. Again, quality is different than just the grams, okay? And it mixes really well without a blender. Whenever I travel, I just mix it in a shaker. And you can make it fancy if you want, but it's a low glycemic index. It helps lower body fat and lowers the metabolic syndrome. So again, a very easy way to get breakfast. And people tell me all the time they don't have time, they can't do it. You can put it in a water bottle and shake it if you had to. Okay, so very, very easy. Plus, if you buy the single serve packets, you can leave them in your backpack, your purse, or even on the back of a bicycle. Okay, so very, very easy to do. All right, so we're moving on to bones. Bones need resistance and nutrition. We lose about 1% of bone per year after age 40, mainly because of inactivity, specifically strength training, inadequate nutrition, or the wrong nutrition. So when you eat a crappy diet, trans fatty acids, again, in the crappier diet, what we show over and over, even the Harvard Medical School, is the wrong nutrition contributes to weaker bones. Resistant workouts, power enhances strength. Other advantages, stability is better, confidence better, motivation to stay active is better, fractures are reduced, and there's a lower risk of falling. So bone density is absolutely vital. When I saw C. Everett Koop years ago in Texas, he said that the second leading cause of death in women is actually a fracture, completely preventable. There are countries that have no fractures in their elderly. So again, we're not doing things right. It is not about calcium. It's about vitamin D. It's about strength training. It's about a healthy diet. Okay, so very, very important. What I teach, if you're not exercising at all, is start with anything, of course, anything versus just strength training, anything. Be active. Our body's meant to move, whether it's aerobic, endurance, strength training, balancing, resistance training, free weights, machines, body fat. One of the very best books by far out there is AstroFit. You usually have to buy it, from like a bookstore now that's a used bookstore, but it's great. It's the #1 exercise physiologist that was hired to work with astronauts. They can exercise in a space suit, spacesuit, and right, and oh my gosh, what is the word? Not flying saucer. Isn't that hilarious? I can't think what it is. What is it? Someone unmute. Oh my gosh, that's so funny. Help, help.
Spaceship? Are you thinking on a spaceship?
Spaceship. Yeah, spaceship. Thank you. Some people tell me they don't have room at home and so on. Come on. They have a spacesuit on, or they have no gravity. They have a tiniest space you've ever seen, and they're in a spaceship. Come on. Everybody can strength train. If you have a chair, you can strength train. You can just do, chair squats. You can do leg extensions. So again, we're not going to be showing you all those things, but resistance training regulates fat cell metabolism at a molecular level. It reduces and slows bone loss and muscle loss, lower body fat, less inflammation, less toxin binding, and improved hormone sensitivity. It's win, 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 win. Okay, you can't not exercise is my rule. Okay, so very, very important. How about when we're talking about cancer? Some of the new studies are incredible. Higher amounts of physical activity are associated with decreased all-cause and cancer-specific mortality in individuals even diagnosed with a variety of cancers: breast, colorectal, prostate cancer, on and on. They also showed that even if someone went through very, very serious chemo and radiation, or very tired, they still should be moving. Remember the old days when someone would have a surgery, they'd have you lay there for back surgery, lay there for, a month and not move. Now, you have, like my husband just had partial knee replacement. They have you moving the knee the second you wake up. Movement is that important. So the studies on cancer, whether it doesn't matter how much treatment, how many drugs, how they feel, is vital if you want to have a chance of keeping cancer free and less chance of death from malnutrition or the medications itself. It was stunning. I mean, data after data after data. So good. I wanted to put so many slides in here, but of course we couldn't. So, but just I wanted to throw a few new ones in there. Okay. So why are phytonutrients important? We had talked at one of our business group meetings where a particular gentleman brought up the apple page. And it's so interesting how when the average person, and a lot of physicians don't know this, but an apple only has about 3 to 5 milligrams of vitamin C, right? And someone say, oh my gosh, Phyllis might say, Valerie, are you kidding me? I'm taking 1,000 milligram vitamin C instead. But that apple and that 3 to 5 milligrams goes up in your blood more than 1,000, and it has thousands and thousands of phytonutrients. Phytonutrients are what keep different things, even if there's genetic risk for turning on cancers. So it's the phytonutrients that are so important. And the nutrition rainbow is great. If you haven't ever looked anything up by the Physicians Committee, they have so many great resources where they tell you about, again, eat the rainbow, every different color. I can't remember if I put it in here or not. Oh, I did. Good. There's a few. But they're showing more and more that we actually know the actual anti-cancer mechanism of phytochemicals. They protect and repair the DNA damage. There's an epigenetic effect that influences genome stability. So let's say someone has a genetic known cancer. In fact, Lynch syndrome was brought up, and I'm bringing that up just because a particular person here. But I have never heard any continuing education, even advanced, that ever brought up Lynch syndrome. And they even said that the epigenetics, the lifestyle, diet, insulin, glucose, can keep it from turning on, even when we know it's genetically there. So again, don't be scared with diagnosis. Get solid, get excited over nutrition. It regulates the expression and activity of transcription and growth factors. Remember we talked about how the tumors grow? We talked a lot about sugar. Sugar, how it feeds cancer, and it's not quite that simple, but really that's basically what it does. She had about 20 slides of that. Boy, oh boy, sure glad I gave up my sugar last year, because boy, I would have after I listened to this lecture. Antioxidant and anti-inflammatory. It suppresses cell survival, proliferation, cell invasion, as well as all the different things that are terrible that happen during cancer. Promotes a healthy gut that actually also affects how the phytochemicals and metabolites actually work with as an anti-cancer agent, whether someone's getting traditional treatment or not. So don't let anyone fool you that Juice Plus or fruits and vegetables are bad for any type. And we went over chemo, radiation, Keytruda, all these different ones. absolutely all positive, not vitamins and minerals, and you have to have deficiencies, but the food forms were different. Okay. Here's the last study that was just amazing. Listen to this, especially some of the people that are here that I know are very proactive and know a lot. American Gut Project. People who consume 30 different plant species over the course of a week have the healthiest and most diverse microbiomes. And then they were showing how that correlated to the reduction of cancer. So remember that number, because remember, that's over a course of a week. So when you take, oh, I don't know what happened there. What happened with my finger? Let's see if I can get that right. Sorry about that. My goodness, got too excited there. So when we talk again about Juice Plus, 30 different plant foods, right? But every day. Now, that doesn't mean you won't get cancer, because one of the things I want to say is often people are still drinking too much. They're obese. You know, there's genetic tendencies. Their glucose is high. Their insulin is high. You know, they don't know they have certain genetic tendencies. They're not sleeping well. It doesn't mean when you take something, you won't get something. So it's never to make someone feel bad, you know, but it also a lot of times when we do these things, it's when we get sick or we're older. It's supposed to be happening in birth. That's why I always think of my friend Gay and her granddaughter, that she's got it from birth. She's, you know, she asks for the omegas and slurps them, you know, as a 2-year-old, where adults complain about them. I'm like, oh my gosh, you know, when kids are programmed properly, they know what's good for them. And we know that there's multiple medical studies showing there's other advantages like inflammation, immune system, DNA, triglyceride, insulin, all these things, microbiota that we've already been talking about, right? So Juice Plus is the foundation, in my opinion, of part of that supplemental therapy that every adult, infant, and child should take. Okay. You know, what's funny is sometimes the only thing that ever comes back at any of my blood work isn't even my blood work, it's in my urinalysis, and my pH is a little high because I eat so many darn fruits and vegetables now that I have my tower garden, because I throw more in and I take multiple capsules and so on. So again, my urine is very alkaline. Okay, blood's fine. So again, you know, it's really interesting that we can push these things up if we do them correctly. And so let's see, what are number 11? Sorry, I got off my quiz. If you're on the quiz, number 11, the number one way to slow bone loss with aging, strength training. Also vitamin D3. Okay, we're going to talk about that yet. What are the thousands of tiny ingredients in plant foods that are called to help prevent disease? Phytochemicals or phytonutrients. And what's the most researched product in the world? Juice Plus. All right, so now we're on what is the most proven eating way to eat? Mediterranean diet. This just was, again, I've said this for the last 2 years when I looked at all the meta-analysis over metabolism, insulin, weight. Now, I just saw somebody that specializes in cancer research, and guess what? Same thing. More than a ketogenic diet, more than anything else you want to believe, it is the Mediterranean diet. They know why. High in antioxidants, anti-inflammatory, protects the DNA, protects cell proliferation, angiogenesis, metastasis. Again, when things grow too fast, make the tumor shrink. The cells look pretty and round. All these different reasons. Now, again, the issue is people think a Mediterranean diet is wine and cheese. That is not a Mediterranean diet. It is extra virgin olive oil, legumes, unrefined carbs, fruit. You may have to limit to 2 to 3 servings a day unless you exercise a lot or you're over 50. You should probably have 2 to 3 or less. Vegetables, lots of them. Fish, wild salmon, red wine if you're not at high risk of cancer. Women are only 1 glass and it's red. And all the statistics show much better not to drink at all. You know, and we'll talk about that too. Dairy only if you don't have certain issues, and that was very low on the list. Lowered mortality in all areas, including cancer, and lower risk of chronic disease. So again, we do have answers. When's the last time your doctor told you to eat a Mediterranean diet? Never, right? I don't even ask you about your diet. So again, that is what is the most proven way of eating Mediterranean diet. Oh my gosh, we did good. It was so hard. You don't know how many slides I wanted to include after having this wonderful CE. So let me see if I can get this off the screen. Hopefully I'm going to do it right. It's not popping up. Okay, there we go. Okay, so I'm going to stop the recording And that way, people, if they want to ask questions, and if you'd like to leave, please feel free. You can go. I'm not insulted, but I want to make sure that we finished in an hour and that people had time to ask